Good morning, everyone. I feel a little strange standing over here and talking to you. Obviously, informal this morning, always informal, but particularly this morning, given our weather situation. And so we're very appreciative for you guys braving this storm, all the presenters, and those of you who came to hear. And partially because of the weather, it's just a little bit from what our slides say, our agenda indicate. But I wanted to go ahead and welcome everyone who came out today and do some introductions, and that I hope will include some people that we have on the call. So we are recording allow them to introduce themselves in just a moment. All right, I think that'll look a little bit better. All right, so my name is Mitch Mueller. I am the manager of the Medical Portal, which is a website that we hope to be able to show you a little bit more about today, and many of you are familiar with already. And I also facilitate this meeting. I work in the Division of General Pediatrics at the University of Utah, under the direction of Dr. Chuck Moreland, who unfortunately has been unable to be with us today. So I'll go ahead and pass it over to Gina, and I hope that the mic can just pick you up.
I'm Gina Cole, and I'm the Director of Legal and Family Voices.
I'm Gabi Barodoshi. I'm one of excuse me. I'm a quality improvement specialist at UCCCCN, which is quality improvement organization under the Department of Pediatrics.
I'm Jenna Diller. I'm the medical coordinator of Infection Pediatrics. I'm Kelly White. I'm here to monitor
You guys want to speak up? Great.
And I'm Gail Six, and I'm the program manager at the Department of Health with the Medicaid eligibility policy.
And I'm Chuck Hayden, one of the supervisors in the health program representatives at
For those of you who are joining us remotely, do you mind speaking up and telling us who you are and where you're at and what you do? I'll go through the names that I can see. This is E.J. Robertson and Debbie Moore. And from the little I know, I'm going to assume that they are part of Health Choice and are connected to about Arizona, but they serve Utah. Yeah, I think we start with the joke this morning about looking at the all that happens then, but now I really look at all that weather. So thank you. As I mentioned, we probably mix this around just a little bit. So I'm going to actually turn it right over to our folks from the Department of Health, who we're very grateful. On relatively short notice, put together some presentations to talk about this morning on kind of a higher level about use of Medicaid. And so we'll let you guys come on over again.
Level 4, grade 12. Code blue, hard and long, level 4, grade 12. Code blue, hard and long, level 4, grade 12.
you want eligibility to start? Is that what you're asking?
I think whatever they make, yeah, in terms of the order, because skills mission,
we have some handouts.
Code Blue, Code Knox, Level 4, Group 12.
Okay. We'll hope someone gets to level 4. Okay. Lane's passing out a copy of our slide deck just so that you have something to take with you that has this information on it. You know, sometimes it's hard to read through everything or get through it and go through the slides quickly. So we'll try to hit the high spots. If you do have some questions, you know, let me know. If it's possible, we kind of wait to finish my part and ask questions. And then Lane will present any questions. Again, I'm Gail Six, and I'm with Medicaid Policy at the Department of Health.
Code Blue, Code Knox, Level 4, Group 12. Code Blue, Code Knox, Level 4.
Okay. All right. So, and Lane London works with our long-term care policy, and he'll talk a little bit about some of those programs. We're going to focus our presentation on children. Go to the next slide. So I don't want to spend a lot of time on a lot of other programs, and we'll tell you again. If you do have a question, you know, you're always welcome to contact us. In Utah, we have medical assistance for some of the following groups of people. We provide services to children under age 19, parents who are caring for dependent children in their homes, and their children, of course, if they want coverage for that. We also have programs for pregnant women, and because this program has no age limit, there are times when and they qualify for those services as well because the income limit is a little higher. And we also provide coverage for children in foster care, placed on for subsidized adoption through a state agency. And one of the new programs that came on with the Affordable Care Act is called Former Foster Care Children. I do have a brochure I'm going to hand out to you, and we can leave the additional copies as well if you'd like to take a few with you. This is targeting children who turn 18 while they're still in state custody in the foster care system, and it covers them for a period of time after that. And then we have some home and community-based waivers. These can cover children as well as people with disabilities. Go to the next slide, please. Text isn't showing up really good. So I'm glad you have a handout, because sometimes that text is, but slides are not always easy. Medicaid eligibility for children. So the primary factor is that the child has to be under age 19. We'll cover them through the month that they turn 19 in the child program. And there are a variety of breakouts in the child category. One category is for children under age 1. And these are children who were born to a mother who was receiving Medicaid at the time of birth. That coverage guarantees coverage for that child for 1 year. Until they've had their first birthday, and surprisingly, that's actually like 13 months, not 12, because we cover them through the month that they turn 81. So we are picking up for that this time period. The other groups are broken out into two different income groups. Children under age 6, and their household income has to be under 139% of the federal poverty level. And there is a chart we have with the poverty, with the income limit in your handout as well. So you know, one idea of what kind of factors I'm talking about. And then children who are 6 through age 18 have to have household income of 133% of the federal poverty level. So a little bit lower, but this is higher than it was prior to the implementation of the Affordable Care Act. The Affordable Care Act raised both of those rates. So we have a little higher income test for them. The Affordable Care Act also changed how we decide what income is countable for a family. And what we're using is really the tax rules. We refer to it as modified adjusted gross income. So if you think about your tax, this is really appropriate at the tax day, right? So if you think about your tax forms that y'all just did, and you're looking at the first page of it, and you have all these line items on the tax form that says what income you received in a year. That's the type of income we count now under the rules of the Affordable Care Act. So we go through and we ask you what these types of income that you'll be reporting on the tax return. There's also on the front page a few things that you might be able to deduct. For example, let's say you're putting money into a 401k plan. That's a deduction on the front page of the tax form. It reduces your total child income. That's allowed under Medicaid programs that use the matching methodology. Matching meaning offset against the gross income. But we do have a couple of differences from the tax rules for Medicaid. One of those differences is that if you take Social Security, other income, we will count the full amount of your Social Security benefit. It doesn't matter whether you have to be taxing whether you live it or not, but we have to add back the full amount of Social Security. Now, most of us probably aren't getting Social Security under the working year, but some people who receive disability benefits and have a family, have children, they might be getting Social Security benefits. And depending on their other income, very little of that may be taxable, or none. But for our purposes, we will add that into the tax. The other reason is for someone who receives educational compensation, their tuition, books, fees, and that sort of thing, that does not count as income under the methodology. And there's one other thing that deals with foreign income, foreign earned income. We don't see that very often. But those are things that are a little bit different than the tax rules in Medicaid. So for the most part, we're looking at federal tax rules. And we're trying to get to that bottom line of what is your adjusted gross income. The other programs for Medicaid, to go to the next one, I mentioned that we cover foster care children, and there's two basic programs for foster care children. One is Title IV benefits. So when the state captures a child in the home, they do a determination about the family's income level that the child is living in. So if that family's income was really low, what the criteria would have been that they would qualify for the old AFCC program, the Aid to Families with Dependent Children's program that was in place prior to 1996. So they're still using these old rules from prior to 1996 to look at the family the child is living in before they remove the child. And so Title IV reasons, we have a federally covered program, and those children automatically receive Medicaid. Other children, if their family is a little higher income and not past that criteria, can still qualify for Medicaid and provide that, but without looking at the regular child Medicaid programs. So we're looking at 133, 139% poverty level. And at that point, once that child is home, it's just a child and it's just being looked at. Now, all of these programs that use the modified adjusted gross income program, by the way, do not have an asset test any longer. So for our children under 19, we don't have to consider assets. Children that are in tribal foster care also can generally qualify for Medicaid while they're in foster care. We also have a program as Catholic Community Services. They're serving unaccompanied minor refugees in foster care centers. And those children will generally qualify for a child Medicaid program. Okay. Subsidized adoption children is another refuge and these children, once the state has made subsidized adoption agreement with the family, those children qualify for Medicaid without an income test. So they can see those differences. Finally, we covered disabled children and medically needy children. I'll have to explain just a little bit about medically needy. I think I missed that on a previous slide. But disabled children, these are children who either can be receiving supplemental security income through Social Security because they're a family with low income, or if their income is a little bit higher in the family, the child can still qualify because their household income that we count towards the child is under 100% of the federal poverty level. There is an asset test for the disability Medicaid program. And then if their income exceeds those limits, we have a program called medically needy. Now, the medically needy is available to children whose income goes over the federal poverty levels that I mentioned to you, as well. Now, with disability, with a disabled child, not all of the parent's income is counted as being available to that disabled child. There are deductions to provide income for the parent and other children in the home before counting some of the parent's income to a disabled child. So the income test actually comes out a little bit better because we don't count nearly as much. We're not counting 100% of the parent's income to make that decision on a child. The medically needy income are quite low. The disabled child can get down to 100% of the federal poverty level. A child without a disability is going to get down to the needy income is also and it's also on the chart, and you can see that chart is a little medically needy on the quite low. But if you have a catastrophic event, just the one with the coverage, the medically needy program is available, and you can use that spend down for just the 1 month maybe with paid coverage. It's not like you have to pay it every single month if you don't have a medical. So that's, and let's see. Slide medically. Okay, so here, pregnant women with income up to the 139% poverty level, parents and caretaker relatives who have a child in their home they're caring for may also be able to qualify, and that income limit is also on the chart. It is not based on the federal poverty level. It's a whole other way that we have to get to that number. But it has gone up since the implementation of the Affordable Care Act, which was a nice thing. It's gone up a little bit. And then, of course, the supportive foster care children. These are actually, it's hard to call them children because they're 18-year-olds and older. And we can cover those youth now until they turn age 26. And this program was put in place because it basically provides that protection that you might be able to give to your own child. Being able to keep them on your own insurance now until they turn 26. Well, a youth coming out of foster care probably doesn't have that option there. They don't have a family out there that they can go back to and say, Mom, Dad, keep me on your insurance until I turn 26 because I don't have any other insurance. So this is a program that basically fills that gap for those youth. And one of the things that we've been trying to do last year is service outreach. Find these youth and help them get enrolled in this program. Because even if they were connected with the society of organizations, ADA, and they could have been over age 20, 21, 22, they may still have a few years of enrollment in this program. And we have I was thinking that they were getting to be traditional. I think it's traditional. All the way through age 26. I'm thinking so. And I think they get to early, early sexual services, they call check. I think they get those until they can one. So that's okay. And then the last thing that we will have for children that's available for children will be the CHIP program. The Children's Health Insurance Program. This is for uninsured minor children. The income limit for CHIP of up to 200% of the federal poverty level. And so it is a higher income level for them. And there are some premiums, there are some co-payments that the children will make. But this is, those co-payments and premiums are based on whether it's under 150%, 40%, or 50%. If they pay less, poverty, they pay more. And they match our income tax. So once we've got the income return for the child, Medicaid, we can be minus Medicaid, we can go right in, look at the CHIP program and see if they're funded. So, any questions? I know it's really fast and not trying to be good. The CHIP premium for kids under 150% of poverty is $10 a month. And they set up on 40 days. So they would go $30 to this kid. Now, for some reason, they're out. Higher income group is $25. No, $25. $25. So it is $25 a month. Anything else? And we use the employer persuader, so we will try to share. The CHIP program is employer plan for their own group in marketplace, and I would CHIP eligible and all insurance. Same income. So a child, or even a child who needs to meet a senior. So if they have primary insurance through the employer, but maybe there's a large rupture. Your child is in the hospital. That happens. And you have to figure out, if you need criteria for that child to be on the Medicaid program, you can enroll them, you can even pay, send them to that 1 month. There is an asset test for medical needs. The asset test is fairly low. It's $3,000 for 2 people, 3 people, but you can do that immediately in 1 month. Tell us how that has cost situation.
For someone like us, okay, are above the poverty level and have their own insurance, how would our child have to live in? No, how do they ever get Social Security and that's how they get Medicaid? We have to do an IRA for your parents.
Well, they don't. As long as the child is under age 19 and living with their parents, we are looking at parenting. So that's why this Medicaid needs program might be available to have a little access. And there are people that they don't have a lot of savings, or they're working, they've got insurance, they're over 133% poverty level. But if they still meet that asset and the child is, well, no, the child does not have to be correct. So there still be an impact family with two parents in the home, but you were still have the assets. But when it comes over and there's poverty for a child that's 6 or older, you could pay them a spend down to get coverage for that one coverage for the high. A lot of people with higher income will fail to get that. That depends on the skill. So, criteria and payroll and hospitalized stuff, how it goes. If that's the value of Medicaid will pick up the rest of the bill, within none of it is what you want. However, let's say a year ago, you had a really high bill, that was paid your own loss. So you owe $2,000 still on this old bill. Well, now they're not going to have to pay bills to your own. You are not happy with that. So if you put $2,000 towards qualified to today to get coverage, we can apply that old bill to today's spending. If there's anything left of that old bill, it can be carried over to you. That okay.
Like income limit, 2015 income limit, changes March of every year, so this will be obsolete in March, so don't use it. Anyway, I was asked to talk about waivers, and waivers are very complex. I love that they're complex because it keeps me employed. So I do like that. If you want to go to the next slide. It's a long-term care Medicaid program. It's available for people with special health care needs. And it differentiates between different waivers as to what the waiver is, I like to describe it as it's its own little pot out here. And it services above and beyond Medicaid. And each waiver, because it's its own little pot, section out there, has requirements. So very complex. There's nothing easy about a waiver. Other than once you're on, it's pretty easy to stay on. So getting on. So Utah has 7 waivers right now. We have 7 waivers. It'll adjust to 7. It's going to change though. And the 7 waivers are aging waiver, brain injury waiver, physical disabilities waiver, our Utah Community Supports waiver, autism waiver, nutrients waiver, and the tech-dependent waiver. Now, I put a star on the, or an asterisk on the presentation on one that applies specifically towards children. Those are the waiver, the autism waiver, and the technology-dependent waiver. Now, I do want to make a note on the autism waiver. Due to the Affordable Care Act and the changes that came out with it, the autism benefits need to be covered under the Medicaid package. So the autism waiver is going to phase out. It's going to disappear over a period of time, and we will not have that waiver in a while. To qualify for a waiver, the applicant must meet specific medical requirements and financial requirements. And when we say financial requirements, I'm referring to citizenship, residency, those types of things. So they have to be a medical component and a financial component. So if you go to the next slide. So the medical component, what that is, they have to, technically the person, the applicant for a waiver, has to be eligible and meet the criteria, the level of care is what we call it, to be in a nursing home. If these services, essentially what the waiver is, if these services weren't provided, the person would have to go into a nursing home. And really the whole point of a waiver is to keep them out of a nursing home setting, to keep them in the community. So there are 4 different agencies that approve the waiver. I'm not going to go through those for sake of time, but they're listed on your handout and on the slideshow. Those are the waiver agencies, or those agencies will determine the medical needs. So remember there were the 2 components. So the next slide, we have our financial component. And our financial component, as I mentioned, it's citizenship, it's residency, it's assets, it's income. Technically income, not really for a waiver. Income will determine how much you have to pay. We'll get to that in a minute. The asset limit for a waiver, generally, we only look at the person's assets. And the asset limit is $2,000 in countable assets. And if the client, I know most of us in here specific towards kids, but if you have an adult or somebody that you might be helping, if the client's married, there's specific rules that help protect assets for that spouse at home. And transfer of assets. A lot of times we'll see people trying to get under a waiver, and they know they need Medicaid, and they know they're over the asset limit, so they start getting rid of assets and just giving them away all the time. Well, according to the law, there are transfer of asset provisions that come into play. And clients who, the programs that Gail was mentioning, clients who meet the eligibility criteria for those programs, they can be eligible for a waiver, and generally they won't have to pay anything for their waiver. Extra services, they just have to meet the medical criteria. There is one, the waivers are designed, I like to train the waivers that there's no income limit technically. They just have to meet a medical category, and then we have this catch-all category is what I call it. I like to get my last ditch category. We try to get these people in under a different category. And if we can't get them in under one of those, we have what's called the special income group. And if they're not eligible for any other type of Medicaid, they can come in under that. And once again, on that, the other income categories, when we're looking for children, we will look at the parent's income. It won't always count. There's some formulas. I'm doing a week-long training in 5 minutes, so hang on. I call this the lagoon ride training. Keep your arms left and side to right at all times. Hold tight, have fun. But anyway, the special income group is just a last ditch. If we can't get them under one of the other groups, income-wise, we'll try to get them under that special income group. And some clients, children not necessarily, but most clients will end up paying something, paying contribution to the cost of care. They have to pay their share towards the waiver services. If you go to the next slide. This website, because I'm blazing so fast, really good general information website. It'll tell you which waiver agency to contact. You know, if you're looking at a specific waiver, who do you call to get going? What are some of the services provided? It's a really good website to go and get general information. And I highly recommend, if you're interested in any waiver at all, go take a look at it. So that was waivers. And I'm sorry that was waving fast, but that's what we get. Unless you want me to come in for a week, I can really train well. I can teach. But the application process. I was asked to talk about the application process and what it'll take to get somebody on Medicaid. And this is the entire package. This isn't just my waiver. It's all the programs Gail was mentioning as well. There is a single streamlined application now. And let me turn to the right page. There's several different ways, once that streamlined application is completed, there's several different ways to get that in to Medicaid, get it into, actually, it's our contracting agency that does the eligibility component. Let's get it into that. You can do it in person, you can do it through fax, you can do it through mail, or you can do it through the internet. Now, there's another website that I've got here, love website, because you can just get all the information you want. And it's great for me as a trainer because I can say, there's a website and it'll help you. But this website here at the top actually tells you how to get it for all these different types of things, whether you do it in person. In person, if you're trying to go in and you don't have the paperwork filled out and you walk into the building, they're going to point at a computer. They really want everything to be electronic. That's really what they're aiming for, the other agencies. And so they'll accept faxes, they really like the internet approach. They'll take an app through the mail if you mail it in. They do accept that. Caution with the mail, delay times. If you're wrapping around the end of a month and it doesn't come in, the app date may be the start of the next month. So just be aware of that. So once the application's turned in and submitted, the eligibility agency is going to take a look at it. And they're going to send the client a checklist. They're going to try to do everything they can to obtain all electronic data information they can get. And then if there's information that they can't get, they're going to send a check. The client will have a set period of time. Generally, applications are processed in 30 days. So at 30 days, the eligibility worker needs to make some kind of determination. 90 days if the client claims a disability. So, as a matter of fact, they say I'm disabled, it extends the application process for 90 days. Now, if you're approaching those deadlines, you're helping somebody apply, and you know you're approaching that day 30, you can actually call the agency and say, hey, we're struggling with these verifications. Please give us extra time. You actually have to say it. You have to request extra time. If you do that, they can extend the 30-day window or the 90-day window to give you extra time to obtain the verification. We do have a retroactive period where if you were to apply today, April is month 1 of your application. Well, you can go 3 months back from April. So you could go March, February, January, the retroactive period, or all the way back to January 1st. So you have to request that. Technically, you don't have to request it. The eligibility worker is supposed to look at it, but my hint to you, if you want to ask for it, make sure it's right after you want it right. I've also included another slide here, me and my electronic stuff. Some good resources. Some of the stuff that we spoke about here in this presentation can be found here. There's this top website, this medicaid.utah.gov. There's some tabs going across the top that give some good information. So on these tabs, I specifically pointed out some information. On the Apply for Medicaid tab, that's that one slide I was talking about. So how to apply. All forms you need. It's really cool. The Medicaid Programs tab, that one's really neat because all these programs that Gail and I just spoke about, you can go in and read an overview, read some of the requirements, read some of the benefits that are there. So that Medicaid Programs tab is good. The Medicaid Member Guide, that's for people that are already on Medicaid, and we're probably going to talk about that other presenters. But it has information there. They can go in and see what benefits are provided. And then the last piece of my presentation is our constituent services representative. If you're having a hard time and you don't feel like the client is being treated properly or something's not being addressed correctly, you can contact Tracy, our constituent services representative. she'll help walk through that and try to resolve that issue. Which one? It's for all Medicaid, so she can help out. So any other questions for Gail or I before?
That application for that site is Medicaid only, is additional, like the work for service. Their
It is, and I can tell you right now, if you want to write it down, it's jobs, JOBS, .utah.gov. And there's a temporary assistant link on there. Click on that temporary assistant link. Now, I'm going to give you my name again and my email address. If you have questions, email me. My name is Lane London, and my email address is LONDON @UTAH.gov. And there's 2 L's, so, and all lower. So any other questions? All right, I like it.
Well, thank you so much. And I have all of this information and make sure that it is available to you guys. The electronic PowerPoint, slides, these guys' contact information, all of this stuff. That was great, great information. The one thing that we so often is this Department of Health to get an app for your mobile device or the web that you can plug in with questions about the family or the situation that they're in, and it can just direct you to the right place, just automatically. So I just throw that out there. That's on the big wish list. Okay, so now we have Chuck Higgins and Terry Sale, who will talk about Medicaid benefits and health plans. And I don't think we've got questions, but now that I'll get them to the internet.
Okay, this sheet that Terry's passing out is like a contact sheet for a lot of different things that we thought might be helpful, so that when you're wondering what's going on and it's been a few days from this, you maybe have somewhere to go and start on who to contact and stuff. So I'm going to pick up where Lane kind of left off, and so you've gone through all this process and you've gotten your people, you're eligible for Medicaid. So what's the next step? They've got their Medicaid. That's the hard part. The next part's relatively easy. We send letters to the clients, and we start calling them on the phone. And the whole purpose of that is to get them to choose a health plan. Because along the Wasatch Front, in the 4 counties from Utah, Salt Lake, Davis, and Weber County, you must have a health plan. In the first month or two, as soon as you're approved at Workforce Services, you're covered under Medicaid fee-for-service. We call it the fee-for-service network. But we're trying to get a hold of you to get you onto one of the 4 health plans. So the 4 health plans that are available are Healthy You, of which we have some people here, Health Choice Utah, Molina, and Select Health Community Care. So there's 4 health plans for them to choose. And we want to really get these people on the plans that's going to get them back to the providers that they need. In a very few cases, people have providers that they really feel they need from plans that do not interact with each other. And that sometimes causes problems. Sometimes somebody has to change a health plan or change a provider and say, well, my most important providers are over here at this hospital area or this clinic. And so I'm just going to have to change my primary care provider or vice versa or something. But we can only have 1 health plan on there. The difference between the fee-for-service and the health plan is that With a fee-for-service network, doctors are just straight billing right to the health department, and we're paying them. We do look at other insurances. We try to, if they have, like, for example, Select Med is an IHC plan, so if they have that, Select Health Community Care, the provider is required to bill the private plan, Select Med first, and then Select Health Community Care picks up everything else. And so all the plans require that, the state requires that, and so that's something that, you know, kind of a mix. So we're getting these people off the fee-for-service as quickly as possible. The state legislature prefers to have people on the plans. We are expanding mandatory counties. These 4 counties that I mentioned will be called mandatory. The rural counties, all the other counties we've generally called as voluntary counties. That's going to be changing in July, and we're going to be adding all the northern counties as mandatory counties, as well as Iron and Washington counties down in Cedar and St. George. They're going to be mandatory as of July 1st, along with everything up north, Box Elder, Cache Ridge, Morgan, Summit, Tooele, and so they're going to be added to our mandatory counties. I wanted to touch a little bit about CHECK or EPSDT, if you've heard of that. EPSDT is just early and periodic screening, diagnosis, and treatment. And that's something that was mandated by the federal government and was added to over the years. And it covers children from age 0 up until they're 21 years old. So that's really, we call it CHECK here in Utah, which is kind of goes along with their checkups and stuff. But it's really applicable to children. So when we're talking about EPSDT or Medicaid for any children, it's the same thing. And really what EPSDT does is it says that any medically necessary item that a child needs, if prescribed by a doctor, is going to have to be provided for that child. So when we look in the field of, you know, what is covered for children, we're almost kind of looking at, well, what's not covered for children. If it's medically necessary, they're probably going to get it. And if you have trouble getting it, Terry's going to talk about the grievance process. On the handout that I gave you, it talks, look at the helpful contacts page. It's a page that tells you, you know, how and who to get a hold of for different things. I'm going to start at the top with the health program representatives. That's the people we supervise. We're the ones that get the health plans. We got an open enrollment coming up. If you've got people that are on the wrong plan, they're with one plan, they really need to be another because of a certain doctor or whatever situation isn't working out, or you have billing problems. There's lots of reasons why people want to switch. That's May 15th until June 15th. We're doing this open enrollment, and your clients are going to be calling us on that top right-hand number. We also help with other things like helping find whatever resources, switching plans. Maybe you want to switch plans in the middle of the year. Can you do that? Sometimes we have some criteria for switching health plans that you can have. You know, if you have a question, give us a call. We'll look at the case to see if they fit one of our criteria for changing a health plan. There's the Utah medical benefits, which slash the meeting here for Utah medical benefits. I can't understate how important this is. How important our website are. They've got search features now, which are really helpful. And they help. So here's our Medicaid benefits website. For information on Medicaid, CHIP, and PCN, a little thing on CHIP education, dental guide, information, really good site. We spend a lot of time on this. And the next 4 entries here: Health Choice, Utah Health, U, Molina, and Select Health, Community Care, 4 different health plans. One of the great things about having a health plan, something that you don't get when you're on fee-for-service, is child care. Child care. Someone who is there to all the needs of the children, to find different specialists, to coordinate those specialists, and all their health care. With fee-for-service, all you're getting is, you know, a bunch of doctors. Most of the doctors who take fee-for-service, probably 98, 99% of them do that. But there's nobody really there to be the point person to make sure that they're talking with the client or with you and helping to coordinate all the things in their organization that they can give to that child and make sure they get. So it's a really good thing to be on a health plan. And all 4 of the health plans have child case management. So this is how you get a hold of them. Their phone numbers are there. And once that person makes, okay, I'm going with plan X, let's do plan X. Call and see what they can do, or go on their website. The next 2 items, Delta Dental and Interactive, are their dental plans. And then we've got Medicaid information line. This is also cool. But it has all kinds of questions if you want to know, is a certain thing covered? I have a billing call in. Maybe it's covered, but I need a prior authorization. So you can find out information about what specific thing you have. If you need prior authorization, call in. If providers want to enroll, if you have new doctors in the office, then we've got Medicaid benefits constituent services. So if you call everybody, you call workforce services, you've denied something and you really thought you needed something, call to the health plan, if you're just feeling frustrated, maybe you don't really know where to go, you can call us at the top. We try to help out those HPRs. But we also have like the last ditch consulting. There's your Medicaid benefits constituent services. And then workforce service. So if you have questions on eligibility, where is the case at, what are we eligible, what applying, you should really be calling workforce services, and that's what we're saying. Okay, another thing that is really important on the other part, flip over, look on the bottom where it says mental health center. Mental health is also a part of that. I'm just going to kind of touch on this real quick, but every county has a different place to go for mental health. In Salt Lake County, it's often mental health, but depending on what county they live in, it's going to be different. So just make sure you're going through your mental health provider in your county. Yeah, so if you have the client's ID number, you can even look up to see if you're eligible yourself. The clients are going to have their own eligibility tool. Just work with about a month, it should be up and working. But right now, if you're just a provider, if you just have the Medicaid ID number, you can go to eligibility here. On that, you can have eligibility score. Eligibility lookup but any of your provider offices, have your own password. Page 4 back here tells you how to sign up and take your own password. Have that, you go into here, and you just enter your ID number, your provider ID number, and then the client's ID number off your Medicaid card. As you know, the Medicaid card is scaled down to that big piece of paper, the little piece, but it's not your ID. That in there with your name, first name, last name, date of birth, 2 of those 3 items. And you're going to bring up your eligibility. You can look up your eligibility for today, for a month ago, 6 months ago. You just can't go too much into the future. Today's April. Yes, as a matter of fact, I've seen it where we've had a client problem over workforce service, and we called them and they forgot to do something. They told the client was eligible, but there's nothing coming over to our system. We have them fix it. They do it. It came over to our system, and we had them pick up their prescription all within like a couple of hours. So it is almost easy. It goes from there. I'll say it several times a day.
Well, we've asked this, update all of our questions for getting into the details of
Okay, so your provider ID, and you can use either a member ID or a social security number. 2 of these. So once you get 2 of those, and you get submit, the date, of course, okay, here you can want to look up today, and there's some today. You can also put in past dates, you will. Sometimes the screen is hard to get to. You might have to do it a couple of times. I've seen it where it's having trouble and just re-entering it. But yeah, if you don't want to talk about it, okay, do we have any questions? And if we were to get, I think, really somebody not a medical representative who really,
If they had
that's kind of like learning, or we have learning stage, and talk about this. So we can get interpreters for that. Down the road, you probably call it, we try to work with the we do have offices where we have HPRs from Provo. We're just going to talk about appeals, I think.
So, sometimes when you're working with you may get appeal a decision. If one of the Medicaid or one of the health plans is denying care or approved fewer services the doctor requested, or your needle treatment, and they stop the services, deny payments for services, they don't get appointments within the required amount of time, they don't set on an appeal or grievance. What's going to happen is when any of those happen, the client or the spouse will be sent a notice of action. And on that notice of action, it'll tell you how many days you have to appeal the decision. Most of the time it's 30 days. On some of them it can be a 10-day time limit for appeal or grievances. Grievances also timeliness, practice of care, quality of care, staff attitude, rudeness, or any other kind of problem you may have had with healthcare services. And there's a health plan on the, or a dental plan, and on the card, and you can find that by looking at leverage we look at people. You need to go through the grievance process with that health plan first. The clients are find these guys online. The website upstairs. And you also can find the member guides. I've posted all of the health plans on here, kind of the same information Chuck had on the contact sheet, with their web address, their phone numbers. The plans are great. If you're having a problem with anything, call and talk to the plan, talk to the case managers. They're really good to work out problems directly, and that will avoid even having an appeal or grievance happen. But if you need to, you can check with their website. These are the form that you need to fill out and turn that in. They do have 30 to 45 days to answer an appeal and back on that. If you have an urgent need, they do have an expedited quick appeal process, a 2-day process on those. You can ask for benefits to be continued. If they're on fee-for-service Medicaid, on the back of here, there's a form here that can go directly to the home hearing office with Medicaid. If for fee-for-service, you can fill it with this form. If you've already gone through the health plan and you're still not happy with the final answer on the grievance, you can also file a formal hearing with the Medicaid office. Our phone number for the formal hearing office is down here. So just a quick overview of how to file an appeal. Have other questions on? You guys did.
And I just wasn't sure that you have that kind of level of authority to be able to help with, those kinds of procedures. Medical necessity. Okay, great.
We're supposed to do that.
I have spoken to one of the care managers around Select, but I'm not sure how they're managing it through their business, but more like we don't have them. So that's kind of makes it what makes it fun is that we already have that relationship with our client.
There should be the same technology.
Question from one of our members who about noting with their family that they work with, students, one man with their
We have their contact information if we want, we can help kids. The other plans here.
So Heidi also has extended the invitation to, I believe, all the care managers and it's probably a matter of Great. Well, I don't know about you guys, but I found this hugely helpful. I think what we will try and do is utilize the recording to go back and pull out some of the things that were especially important. And then maybe connect with you guys again, make sure that we're on track with regard to questions that we know you guys have and make sure that we're doing that. But I think this is very helpful. It is confusing. It is big. And so happy to hear that the search feature and the websites themselves are getting improved. Actually, that will be a big help for folks. Also, really nice to know that there are numbers that they can call. And particularly that constituent services number, although, of course, we'll probably not call. One last, let's start.
I just wanted to know if you could do a take back to Medicaid on the eligibility screen. It works great for all of these videos, like for Healthy, Utah, or Molina, they don't require a secondary ID card, but the Select Access has a secondary ID card, and the family can bring that to an appointment. You have maybe a Medicaid card, but not a Select card. And you look at the eligibility, which just tell you they have Select, but it doesn't provide that their ID number.
We told Health and Molina that even if a client doesn't bring their card, if they brought their Medicaid ID card but not the plan card, we're still supposed to take the client. We're not, it's easier if they have it, it's even easier for their billing, but it's not something that they can get some, we're still having spotty trouble with that here and there.
With our clinics, we've not taken the kids. It's just my billing office has to put a marker after the fact when you don't have any.
Yeah.
Have to
take
Yeah.
it back and ask them.
And I realize it's probably not
we'll mention
entirely a purview.
Yeah, and we do, during our orientation, the people that we talk to, whether it's over the phone or in class, or we even have an online orientation, we tell them that they need to bring their health plan card as well.
Okay, so, welcome. If you understand, letters related today for sure. So, this is the way we quick review of the medical home course, which was part of our agenda today, and then we'll let you get out of here on time. I would like to say out that there is a lot of students on this activity that you are encouraged to do that. And again, thank you for those of you who came a little bit late for braving the weather. So we wanted to show you our newly redesigned website that launched last for almost a week now. There are still a few little things that we'll be tinkering with that we've noticed aren't looking quite perfectly, and then there'll be lots of other things that we need to improve over time. But this is an effort that we've been working on for something like a year, and so we're really pleased to finally get it out. And we always knew that it was underway, so that's why we haven't really tried to show you the medical portal before now. And because today's meeting obviously we did try and focus on some of our local service providers, some of our most important local service providers, we also wanted to make sure that you recognize that the medical portal is intended to be another resource, another tool for you to help find information that can help with families, and also resources and services in the area. So we'll focus on that. But if you were familiar at all with the previous version of the medical portal, it looks a little different. Largely, though, where that is, it should be the same. So and we used to have for parents and family content and for physicians and professionals content on the left and in the middle. And we're trying to sort of indicate that this kind of content is a little different than what you're finding in the stuff on the right and the left. We used to also have the content that you'll find in these two sections combined, and we felt that really our local services database was important enough to get it always have. So hopefully that will help. We know that we are partnering with 4 states right now, and we actually have Nevada in each of them in 2005. And once upon a time, you would try and figure out the states that we're interested in over here on the left now up top, prominent. You'll also see that our Google Translate is prominently displayed at the top. So hopefully that will be more obvious to people that know information about that. And of course, the search bar is more prominent up here as well. One of the very next projects that we'll be working on, and this is again on the way, we'll be continuing to improve our search and the way that our results are displayed to help you find more quickly what you're looking for within the site, and that's something we want to encourage you to do. You can see our sliders. We've got a little more work to do on those, but hopefully we've got some good visual things that will help make the site more interesting. You can see the colors are updated and feel a little more modern, I hope. Definitely something we want to work towards. I'll just scroll quickly down this homepage so you can get a feel for how it is different, although you don't really expect that you'll go too often to the homepage, and that's great because we want you to find the things you need deeper in on the web content. So I'll very quickly click on each one of these, but don't have the time to decide too deep, but would encourage you to spend some time if you can. We have 44 different conditions that we have really quite detailed information on it. So when we do what we call a module on our diagnosis or a condition, we have information that talks about the an overall description, which would include information on the prevalence of it, whether it's had a genetic basis, prognosis, and so forth. We also make sure we include practice guidelines when they're available for a given condition or diagnosis. We have a section assessment, which we believe primary care providers can be doing on an ongoing basis for a condition complex to this. We believe that the treatment and management section for each of our modules is probably the most frequently looked at section for optometry. And we feel like this is a really great section for each one of our modules because you can try and look at a variety of systems that may need to be addressed for the specific condition, and then we offer information on what kind of subspecialists you might want to connect with, and we do the right to so that the basic children areas children get. So these will all be testing for whatever diagnosis that you chose if they are relevant. And you have expert authors who work with us to create these reviews. We do have some frequently asked questions. These would be from the perspective of the primary care doctor and outpatient specialist. And these diagnosis modules really are written for the primary care physician, but we have in mind here because we estimate that for many of these physicians, they just aren't going to see them very often, and they won't have all of this information in their health. And then we also have related issues because often there are things that go along with conditions that need information on that we typically link to a separate page on our website. That's where we learn more about gastrointestinal and bowel function or prevention. And we do like to try and include links to resources, like the websites of interest, or handouts, those kinds of things, and then tools as well. Finally, we also try to include any service provider that we think would be of use to a family and a patient with this information towards the bottom of each module. So kind of that branch can see anyone that we included within that module as something that would be a value and then thinking into our service database and connect with someone who can do it. Newborn disorders. We currently have information just one page on every newborn screen for in Utah. And we actually have a full diagnosis module on here as well. But really what this is intended to do is to help a primary care doc know what the next steps are in the quality of screening is happening. I think we've talked a little bit about the parents and families content before, which is quite transparent, we know that. But we hope that you will be able to define what you're looking for utilizing the lesson over here for the search. We have just a great deal of information. We're very fortunate to have the customer license group work with us to create the content and get the content that we need. Very valuable to families. How did I diagnosis to meet the topics that are going to determine lots of great information there. The information in our four positions in the specialist area isn't quite as vast, but we're building on it. We do have information here on the concept of medical home from that provider and team perspective. With information about education in schools. We have some pages on medical technology that we'll continue to add to. And we do have some information on screening and prevention that we continue to add to these as well. The transition issues and health supervision guidelines where issues where we're having. And the other resources quickly. So this is really kind of I showed you a couple of these things in a diagnosis module if there's a patient education form that has been established and embedded for particular conditions, we have it here in that diagnosis module where you area for it's likely principal to be sent to a family or a patient there. To see for the mental health team. Information support, these are largely these websites again, sometimes handouts. We have registries and studies, so this is here. And then anything we can refer to a citation or a piece of literature. You've seen our services area before, it looks a little different. We do have around 300 categories that are from the top level to the lowest level here. They're browsable, so you can scan through and try to find the general category that you're looking for. Or you can use our search up here to try and find what you're looking for as well. And once you've gotten into a section, then you can look by city, the general city or region that you're looking for. We're going to continue to improve upon these as well. There's lots of different ways to sort and filter this information. And again, we'll continue to improve our search abilities for those. And we also have a feature that's coming very shortly. We've got it. That you would like to try and provide information on the services in regards to your family in question. You'd be able to go through our database and check the ones that you're interested in, have that compiled, a list on the website with the URL, and then be printed, send up a link to someone in that way. You can save it as a PDF. Lots of options there. You can share it with another for you, like to do that, and they'd be able to get a copy of it and then modify it. So you can see the unit, and now we can have the access to it as well, so it can be kept updated or computer-based updating information. So that's coming soon. So it's 10 o'clock. Any questions? Right, sure you don't have to that. No? Thank you very much for coming out today. I really do expect to be past with many of you, so really appreciate it. And we did record the session. My fingers crossed that that recording came out well, and we'll make that available. So if you want to caption it, or if you want to refer someone to it as well, we'll have that. Be safe driving.